What is teratogens? Any disease, drug, or other environmental agent that can harm a developing embryo or fetus. Same defect can be caused by different teratogens, and variety of defects may result from single teratogen. There are 4 types of teratogens: physical teratogens, infectious teratogens, chemical teratogens, and metabolic conditions.
What is physical teratogens? These are agents that come from the external environment that physically affect the mother and can harm a developing fetus. Example of physical teratogens: hyperthermia, extreme physical trauma, and X-rays, which can cause abortion, mental retardation, and abnormal head size. What is infectious teratogens? TORCH is an acronym for a special group of infections that can affect the developing baby during pregnancy. TORCH stands for the following: toxoplasmosis, other infections such as Group B Streptococcus, Listeria and Candida, Rubella, cytomegalovirus, and herpes. Infectious teratogen can cause mental retardation, cranial abnormalities, eye development defects, cataracts, and hearing loss.
What is chemical teratogens? These are agents that are ingested by mother or inhaled from the environment. These are examples of chemical teratogens. Drugs, both prescription and illegal, can cause congenital abnormalities. Alcohol, which can cause facial deformities, arms and legs, heart conditions, or neurological problems. Cigarette. Environmental chemicals. What is metabolic conditions? Metabolic conditions are abnormalities in the chemical process of producing energy from food, and thereby affect the development and function of the body. If a pregnant woman is malnourished, then her fetus likely lacks the nutrients essential for its development.
Now, let's proceed to the research of Dr. Wendy Chung with the title of Teratogens and Their Effects. Teratology is the study of abnormal development in embryos and causes of congenital malformations or birth defects. Causes of congenital malformations includes: Number 1. Genetic factors such as chromosomal abnormalities as well as single gene defects. Number 2 is environmental factors such as drugs, toxins, infectious etiologies, and mechanical forces. And number 3, multifactorial etiologies including a combination of environmental and genetic factors.
Examples of teratogens known to cause human malformation are the following. Nicotine does not produce congenital malformations, but nicotine does have an effect on fetal growth. It decreases the supply of oxygen and nutrients available to the embryo. Alcohol is a common drug abused by women of childbearing age. Infants born to alcoholic mothers demonstrate prenatal and postnatal growth deficiency, mental retardation, and other malformations. Retinoic acid or vitamin A, the most common malformations include craniofacial, dysformism, cleft palate, and neural tube defects. Maternal medical condition can also produce teratogenic risk, for diabetic mothers have an increased incidence of congenital heart disease and central nervous system, and infants of mothers with phycotonuria can have a significant risk of mental retardation, low birth weight, and congenital heart disease.
A congenital malformation is an anatomical or structural abnormality present at birth. Congenital malformations may be caused by genetic factors or environmental insults or a combination of the two that occur during prenatal development. Most common congenital malformations demonstrate multifactorial inheritance with a threshold effect and are determined by a combination of genetic and environmental factors. Major malformations are more common in early embryos than in newborns. However, most severely affected embryos are spontaneously aborted during the first 6 to 8 weeks of gestation. During organogenesis between days 15 to 60, teratogenic agents are more likely to cause major congenital malformations.